Good afternoon. Now, Mr. Gill.
Thank you, my lord. The next witness is Helen Goss. She is joining us remotely to give her evidence. She has provided the inquiry with a statement. The reference to that is SCI WT 0568 and then 501.
Very good.
She is giving evidence on behalf of Long COVID Kids Scotland, and this is an impact statement.
No, I think possibly Ms. Goss is on the screen in front of me. Is that correct?
She is, hopefully.
Can you hear me, Ms. Goss?
I can. Hi.
Good. Hello. Good afternoon. Right. Now you're going to be asked some questions about your statement by Mr. Gale, and I think probably you'll be able to see Mr. Gale in a minute or two if you can't already. The technology here is a bit beyond me, as you can gather. Right.
It's fun being the first.
No, there are benefits in not seeing me, Miss Goss, I can assure you. Right. Miss Goss, your full name is Helen Goss, I think?
Yep.
And can you just tell us how old you are, please?
39.
Yes. And you are the Chief Operating Officer for Long COVID Kids Scotland. Is that right?
Chief Operating Officer for Long COVID Kids, and I run the Long COVID Kids Scotland part of the charity.
Right. Thank you. How long have you been doing that?
Oh my goodness. I first found Long COVID Kids as a group, for we're a charity, in January 2021. And then I joined the team in June 2021 and opened up Long COVID Kids Scotland as a group. And we applied for charity status in 2022 and then got charity status in 2023.
Now, I think, Ms. Goss, you have long COVID yourself, is that right?
I do. Not nearly as bad as my daughter, but yes.
Yeah. And your interest, obviously, in long COVID kids, as you've just alluded to, is inspired through your interest, obviously, in the condition of your daughter. Can I just pause and ask, just for various reasons, that you don't name your daughter, but just refer to her as your daughter, if you wouldn't mind doing that for us. Right, you provided us with a statement, Ms. Goss. Can I just preface what I have to ask you by saying you have also provided us with a number of documents which you've drawn our attention to. We're very grateful for you providing us with these documents, and can I assure you that all these documents will be considered and analysed by the inquiry team and taken along with the evidence that you are giving. So please don't think that these are filed and put away and never looked at again. They will not be. They will be looked at in great detail by us. And can I also say that the inquiry will be looking at the subject of long COVID in general terms, not just relating to long COVID kids. So you can be assured of that as we are progressing in our investigations. And can I also say that a number of witnesses have already mentioned and alluded to long COVID, so we are aware of the concept of long COVID, the condition, the symptoms, so we are aware of that. Can I also say to you at the outset that if you require and would like to take a break at any time, during the giving of your evidence, please just say so. Don't soldier on feeling that you have to do so. If you would like a break, please let us know, and that will be facilitated for you. Right.
I will do. Thank you very much.
Right. Ms. Goss, can I ask you to tell us a little bit about long COVID kids? You start this really in paragraph 0.2 of your statement. And I wonder if you would just help us by reading that out so that we get a flavor of long COVID kids as an organisation.
Yep, of course. Long COVID Kids Scotland was established to support and guide Scottish families with children and young people with long COVID. We advocate for the recognition, support and recovery for long COVID in children and young people. Currently, the Scottish branch provides support to over 250 families, with this number growing all the time. The importance of my previous sentence cannot be more emphasised. Long COVID isn't something that happens to already unwell children. Quite the opposite, in fact. In our experience, the children affected were very healthy, with active, busy social lives filled with extracurricular activities. And B, only as a result of the peak of the pandemic, long COVID is still a real and live risk.
Can I just pause there, Ms. Goss? I think you emphasise this point because you quite clearly want to emphasise this point. Is that because there is a perception in the wider community that really long COVID only affects children with pre-existing conditions?
Yeah, you're right. I think from the very beginning of the pandemic, we were told by our governments, by our public health bodies, that children were not at risk or were extremely low risk. And while that may be true for acute infection, children often have mild infection or asymptomatic COVID-19 infection, but they never talk about the long-term consequences of that infection.
Right.
And yes, I think that people don't realise that actually you can develop long COVID on any subsequent infection. So while you may have been fine with your first, second, third COVID infection, on your fourth infection, you may develop long COVID. And I don't think the consequences of that are really understood. You know, you have to think about your children, your grandchildren, your nieces, your nephews, and what they're doing right now. They're going to school, they're enjoying their hobbies, they're socializing, they're living their best lives. And then imagine they get COVID and you think, oh, it's not too bad, it's just a cold, as we're told. And then a month later, 2 months later, perhaps, they can't go to school, they can't do their hobbies, they can't socialize. They're very, very sick, and that could last a very long time, years.
And I think in paragraph 0.3 of your statement, you essentially emphasize that point again. And I think you also indicate that long COVID kids is supported by expert advisors, also has lived-in experience from peers via advocacy, and you provide assistance trying to navigate the various systems we have come to cross. Now, I don't want you to name the advisors that you have, but I understand you have both medical and legal advisors. Is that correct?
Yes.
And you put it in this way, you provide assistance trying to navigate the various systems we now have to cross. That's perhaps a rather loaded way of putting it. What do you mean by when you say you have to cross? Would it be fair to say it is just the systems that you have to encounter, or is it more difficult than that?
Encounter, fight with, battle. It's ridiculous at the moment, Mr. Gale. I cannot emphasize this enough. Okay, so it's really upsetting that we are having new families join our support services in 2023 who are still facing the same obstacles and challenges that we faced in 2020 and 21 and 22. Nothing has changed. And these navigating the systems, by that I mean trying to access healthcare, trying to access social care, trying to access accessible education. It is almost impossible sometimes, depending on where you live, depending on the level of understanding of long COVID in children, depending on local government, local authorities. It's just an absolute battle every single day to try and get your child the help and support that they need.
Thank you. Could we go to paragraph 0.4 of your statement? And could I now trouble you to read some of that, please?
Yep. Okay. When people talk now about COVID-19, often it's around lockdowns, restrictions, and how happy they are to be back to normal. For many children and young people, they've never and may never go back to what normal looked like to them. There's this misconception, even to this day, that COVID-19, let alone long COVID, is only a risk to the infirm or elderly, which is simply not true. This is a misconception held by people in positions of healthcare, policy, and education, people in positions that should know better by now. For those who didn't die or weren't hospitalized at the peak of the pandemic, which are still suffering our injuries today, we've been forgotten.
Would you just continue on reading until I ask you just to stop, and we'll clarify one or two things. If you can just continue on reading, please.
As of May 2022, there was believed to be over 10,000 children in Scotland suffering from long COVID. In the same vein that COVID-19 was not and is not just the flu, long COVID is not just tiredness. People suffering with long COVID struggle with what would have previously been for them simple daily tasks, with cognitive dysfunction so severe they can forget basic personal information. In children and young people, long COVID causes neurological, musculoskeletal, gastrointestinal, and cardiovascular symptoms, serious cognitive impairment, headaches, migraines, and muscle ache. Symptoms also overlap with conditions such as ME/CFS, PEM, PANS, and MCAS. Some go on to develop PIMS-TS.
I think we're aware of those acronyms, so I don't need to ask you to explain them all. But could I just go back to the beginning of that paragraph and the figure of over 10,000 children in Scotland? You've given a number of footnotes to your statement, and the footnote to that is a reference to Jackie Bailey, MSP, and a long COVID debate in the Scottish Parliament. So that figure, is that a figure that has had any official recognition? And as a second part to my question, is it a figure that you consider to be accurate?
I'll put this down because I'll forget your second question. Okay, so that figure comes from, it is an estimate. That figure is based on the Office of National Statistics data, where we believe that there are around 170,000 people in Scotland in total suffering from long COVID, and it is a percentage of that based on the evidence that exists on prevalence in long COVID in children. The reason that it is an estimate and not a fact is because the Scottish Government have failed to and continue to fail to gather data on long COVID in Scotland. So in truth, we have absolutely no idea how many children are suffering from long COVID. Your second part, is it accurate? I think I just covered that.
It's an estimate. It obviously has to be an estimate. Do you know why Scottish Government has failed to produce data on this?
Incompetence? Laziness? I don't know, you'll have to ask them, Mr. Gale. We've brought it up a number of times, several times. In fact, we have asked them until we're blue in the face to count long COVIDs, and they still are not doing it.
Have they given an explanation as to why they're not doing it?
Nope.
Okay. Can you surmise as to why they're not doing it?
I suspect it's because the numbers are very large, and if there's a large number, then they have a problem they have to deal with, and that's probably quite an unsavoury thing to have to face.
Okay. Right, can you go back to your statement, please, at paragraph 0.6, and could you read on from that, please?
Long COVID Kids Scotland are supported and championed by practising experts and professionals in a range of fields such as law, paediatrics, occupational therapy, immunology and virology. We work closely with academia and other charities and are recognised by organisations such as the World Health Organization, the Centre for Disease Control, and we are a recommended resource in the NICE guidelines. We are key stakeholders in high-level meetings with the Scottish Government, the NHS, and in research collaborations such as with Derby University on healthcare and education. The organisation is unique in that it documented and tracked the post-COVID-19 impacts on children in real time as the pandemic unfolded. We provide evidence and concerns on the risk of long COVID as a post-COVID condition that is as a long-term chronic illness and or disability.
Can I just pause there, Ms. Goss? And this may be a difficult question to answer, and if you can't, please just tell me. You say there that your organisation has tracked the post-COVID-19 impacts on children in real time as the pandemic unfolded. Are you able to give us an indication as to when the issue of long COVID in children started to manifest itself?
Oh goodness, right at the beginning, Mr. Gale. Our CEO and founder, Sammy McFarlane, she started Long COVID Kids in August 2020. And there were already families joining all the time whose children had not recovered from COVID-19 infection in the first wave. So it became very apparent very early on.
Thank you. That's very helpful. Thank you. Can we go back to your statement, please? Paragraph 0.7. Would you read on from that, please?
Our position strongly is that the Scottish Government's measures and key decision-making did not, and still does not, go far enough to safeguard the health and development of children and young people. This is in contrast to their own Getting It Right for Every Child, GERFEC. Children and young people living with long COVID are dismissed and ignored. to the detriment and expense of their health, education and welfare. Policy has not changed for the better, and new evidence is being ignored, with mitigation measures that were already poor being dropped. Our position is that the Scottish Government have been negligent, both in the discharge of their responsibilities and their failure to keep up to date with contemporary research. We make particular reference here to the Jason Leach letter of March 2022, where at page 4 evidences they only took mortality into account and not morbidity. That is, long-term consequence like long COVID. And his further letter of April 2022 at page 5, where paragraph 5, apologies, where he advises children can go into school if they are symptomatic.
Again, can I pause there, Ms. Goss, because obviously you make some fairly trenchant criticisms of government in that paragraph. Can I just go, however, to something you say at the beginning of the paragraph, where you say children and young people living with long COVID are dismissed and ignored to the detriment and expense of their health, education and welfare. Now, obviously, from the point of view of these hearings, we're looking very much at health. And can I emphasize to you that other colleagues within the inquiry team will be looking at issues of education and welfare. And I think in previous discussions with you, I've explained that. And also, I'm aware that you do say something about that in your statement. However, what I'm interested to know is what you say about children and young people living with long COVID are dismissed and ignored. Who do you feel they are dismissed and ignored by?
They are dismissed and ignored by the very public bodies who are there, who are supposed to protect and support them. They are dismissed and ignored by the Scottish Government. They're dismissed and ignored by NHS Scotland, by Public Health Scotland, by local authorities. There are no policies in place, and the healthcare provision for long COVID does not exist in children, in paediatrics.
So how does that dismissal and ignorance of children with long COVID, how does that manifest itself, or how has that manifested itself to you?
To me personally, or
to you personally, or as an organisation? And again, please be careful not to name your daughter.
Yeah, okay. To me personally, I have spent many an evening crying on the bathroom floor because I have absolutely no idea what to do next because nobody is helping us. And my child is extremely sick. She's not getting any health care from NHS Scotland because they do not understand long COVID and have not been supported with the most recent evidence. So they are not aware of treatments that can help improve quality of life. I have struggled for the entire time. I know we're not talking about education, but I have struggled the entire time to get education for her, and only recently has she started to get some. And social care, again, we were referred in January 2021, and we've only just been given a caseworker in the last month. And honestly, this story is repeated over and over and over again. The impact on families is life-changing, devastating. It has broken up families. It has parents and carers have lost their jobs because they have to care full time now for their sick child. Families have had to move house because if they've gone down to one income, perhaps they maybe can't afford their house, they need to downsize. Families have also had to move into more appropriate houses, such as there's one family in Scotland who recently had to move to a bungalow because the stairs were too much for the child. the impacts are so far-reaching that our lives are completely different.
All right, thank you very much for telling us that. Would you go to paragraph 0.8 and just read that paragraph, please?
Before I do that, can I maybe make reference to some of the letters from March 22 and April 2022?
Yes, if you wish, yeah.
So previous to those, in September 2021, this is relevant because it does give some kind of context and maybe a little bit of insight to the Scottish Government's feelings towards long COVID at the time, or feelings to advocacy and campaigners in the public arena. So in September 2021, the National Parent Forum of Scotland held a webinar, an online webinar with a Q&A opportunity with the clinical director, Jason Leach. And I attended this webinar just to listen initially. Unfortunately, I signed in very early and all the cameras and mics were on. And as far as I'm aware, Jason Leach was not aware that his camera and his mic was on, because the host of the webinar said to him, "I hope that everyone is nice to you with their questions this evening." And he said in reply, "I hope so." What did he say? Sorry, I'm just reading my notes here. Well, he referred to parent advocates and campaigners who were campaigning for mitigations and public health measures as extremists. And he said that there were either the extremists on one end who were telling him that he was destroying children's education and keeping schools closed, and on the other end, the extremists who were saying that he's harming their children, harming our children, and that he needed to do more. So, and I sent a little message into the chat function of that webinar, and I said, you know, I don't think Mr. Leach was aware that we heard his comments about extremist parents before the recording started. And I said that was very unpleasant to hear. And he sent a private response. I don't think he was aware it was me. I'm still not sure he was aware it was me. He sent a private response apologizing for his language. And I just think it's really important to highlight that, because I think that shows potentially what the government were feeling at the time, that people who were campaigning for the health and well-being of children had extreme views. And I don't believe that the health of children is an extreme view.
All right, well, thank you very much for that amount of detail, Ms. Goss. Can we go back, as I asked to you, to paragraph 0.8, and you talk about the strategic network which was established in March 2022 with a budget of £10 million, a support fund from the Scottish Government over a 3-year period. I think one of the points you're making and continue and make further is you are unclear as to the extent to which that has been devoted or utilised in relation to long COVID, and particularly long COVID in relation to kids.
Yes, this has been a problem. The long COVID strategic network was set up to assist the 14 health boards in planning, developing and implementing long COVID services in Scotland. Unfortunately, they started planning, developing and implementing adult services. And in a meeting, I can't remember exactly what the meeting was for, but in a meeting this year, which I know is out of the scope of the inquiry, but it's good for context, in a meeting in February this year, one of the lead clinicians for one of the health boards said that they didn't realise they needed to develop paediatric services. I really fail to understand how we've come this far and they still don't know that we need paediatric services when Long COVID Kids, has been having regular meetings with the Scottish Government. The Scottish Government are very well aware that children develop long COVID and need some health care and support and treatment. So why has this not translated down to the very network who is supposed to be implementing this? So that's one problem with the network. The £10 million is over the 3 years. So that equates to roughly about 3 million per year. So if you divvy up 3 million between 14 health boards, and obviously it's done proportionately by population, it really is not very much at all. And it certainly isn't enough. And again, we have told the Scottish Government time and time again, this is not enough funding. You need to put in more money, because at the moment the health boards are struggling to actually plan these services because they cannot afford to recruit. They struggle to recruit because these are on short-term contracts, which nobody wants. They cannot recruit enough people in the right specialities. It's such a mess, quite honestly. And it does feel as though the Scottish Government have just said, right, here's a pot of money. Go and figure it out yourselves. There's no direction from them. They've just sort of. I think they believe they've done enough, honestly, and they certainly haven't. They are not prioritising it how they should be, and there needs to be a lot more attention on COVID. Shall I go on to talk more about the network?
I'd like you to. We can read what you say at 0.8. Could I ask you to go on to your your key areas of concern, which you do in, you start at 0.9, but then it becomes paragraph 1 and 1.1. The first is in relation to lack of public health information and communication. Now, the inquiry has already heard a good deal about communication. We'll continue to hear about communication, but we'd like to hear from you about your impression and understanding of the level of communication you've had or your organisation has had. So would you read on at 1.1, please?
Yeah, sure. It became apparent early in the pandemic that children transmitted COVID-19. However, there was and still is poor public awareness of the risks of long-term sequelae associated with COVID-19 infection in children and young people, and the increased risk associated with reinfections. The Scottish Government continued to repeat the narrative that the risk of children contracting and transmitting COVID-19 was low, despite evidence to the contrary. There was also no accurate data on the prevalence of COVID-19 and long COVID amongst children and young people in Scotland. Public Health Scotland modelling, which has now ceased, reflected the ongoing and escalating problem, but this did not measure prevalence. ONS findings were also only good for the whole of the UK. There is no Scotland-specific focus.
Continue on, please.
Symptoms were being presented beyond the 3 cardinal ones, yet the Scottish Government would not permit attendance at testing. Additionally, children and young people do not present the same in acute infection. The Scottish Government and NHS Scotland did not update their symptoms list on their websites in a timely manner. There was also a discrepancy between NHS boards and local authorities in relation to their symptoms list. This led to many families not prioritising testing, especially in instances of asymptomatic acute infections or missing symptoms.
Go on, please. Would you read on until we get to the next subheading of lack of access?
Public Health Scotland, in their three-part survey, Are the Kids All Right?, excluded the direct harms on children and young people experiencing long COVID. Their response to questioning was that the EVE-2 study addressed this. However, this is false, as it only covered prevalence of long COVID at baseline population level and did not take account of age, gender, demographics, let alone the views, feelings, or lived experience of children and young people suffering from long COVID. In December 2020, the Scottish Government published Coronavirus COVID-19 Framework for Decision-Making, Assessing the Four Harms. There was another failure to address long COVID within any section of the framework. It was excluded entirely.
Can I ask you what level of communication and guidance would you wish to see in relation to long COVID in kids?
Yeah, absolutely. I'd be glad to say. Well, first of all, I think we need to get really back to the basics, and public health messaging needs to acknowledge that SARS-CoV-2 is an airborne virus and that is the primary route of transmission. They also need to acknowledge that COVID is a vascular disease, that it causes organ damage, cardiovascular complications, immune dysregulation, brain inflammation, it can cause diabetes, epilepsy, so many conditions. And this has not been communicated to the public. And I believe this is why the public believe that now COVID-19 is just a cold or a flu. It certainly is not either of those things. It's far more damaging. It's also really important that there's public health messaging about the risks of long COVID. Nobody seems to be aware that you can develop long COVID with a subsequent infection, and parents and carers need to have this information so that they can make their own informed risk assessment for their own family. How can families make informed decisions if they don't have all the information? So I think that has been a really big failure on the part of our public bodies, unfortunately. They have not communicated the risks, and that means everybody is just thinking that COVID-19 is quite a benign infection when it really isn't.
All right. Okay, thank you. You then go on to talk about lack of access to health and social care. Again, I think it's probably easier and more effective if you would read from paragraph 2.1 onwards. We will interrupt it with a reference to the diagram that you provided in your statement, just to get a little detail. But if you would just read through that section, please.
We recognise that healthcare professionals have been left unsupported and untrained, which results in many not recognising long COVID symptoms and failing to refer patients to appropriate care. Because healthcare professionals are not appropriately trained, they are not recognising symptoms, therefore no diagnostics. No diagnostics means no treatment. There's also a culture of failing to refer patients or refusing to refer patients, where they or their family have conducted their own research. This further results in inconsistent care across NHS health boards, leaving children and young people at a postcode lottery of what diagnostic testing, treatment and support they will receive. Families are having to learn about long COVID alone, with many resorting to private healthcare in a desperate attempt to find some relief for their children. They then faced further barriers, with NHS staff refusing to collaborate with private healthcare.
Let's continue on, please, Ms. Goss.
There is nothing being done at policy level to ensure long COVID is tracked. Primary and secondary care each have their own individual systems, both where the condition is often listed as post-COVID syndrome or post-acute sequelae of COVID, so many can't find when they search for long COVID. This has obvious and serious implications for data collection, with an underreporting of the prevalence of long COVID and the assumption that pediatric long COVID is not of significant concern. It is paramount that partnerships are created through the NHS, private practitioners and families, and we consider this can only be appropriately managed at government level.
Continue on, please.
We are also suffering inappropriate treatment such as graded exercise therapy, even though this is not recommended in NICE guidelines, which state the harm in doing so. Healthcare professionals are also recommending cognitive behavioural therapy. You cannot exercise your way out of a chronic condition with untreated underlying pathology. And similarly, CBT may be beneficial as a supportive measure, but it is not a treatment. Children and young people who have long COVID may also suffer from symptoms such as chronic pain that leaves them immobile, yet they are not being provided with mobility aids.
Now, before we come to your diagram, could I just go back to one of the points that you make in that section? You observe that there has been difficulties in accessing treatment and care where individuals have been, as it were, conducting their own research into long COVID and presumably then presenting that to healthcare professionals. Is that something that has manifested itself on a number of occasions in your understanding? And can you hazard a guess as to why that might be?
Can you maybe ask that in a different way? I'm not understanding what you're asking.
Okay. You've made reference in your statement to where families have had to conduct their own research. And what I'm wanting to know is, has that been a difficulty insofar as accessing treatment that has occurred in more than a few cases? Is it something that you've come across in a number of situations? And can you, the second part of the question is, can you hazard a guess as to why that might be?
Right, okay, sorry, I understand. Yes, it's happened in every situation, with every family. So because in the first couple of years, or first 3 years, I suppose, of the pandemic, the Scottish Government insisted on strengthening existing services instead of choosing to create clinics. The problem with strengthening existing services is that that model would require every single healthcare clinician in Scotland to be knowledgeable on long COVID. That is completely unfeasible. It's a new condition. It's something that there's constant research coming out. There's constant learning. You can't expect every single person in NHS Scotland to be studying that in their free time, and they certainly don't get any paid time off to be doing it. So that's where the problem lies, is that there's been no education given to healthcare professionals, and it's implied that everybody should know about this. So yes, families go to their primary care provider, and of course they are not up to date on the latest research. How could they possibly be? You know, GPs are already under immense pressure. They simply do not have the time to be hunting down the research, whereas the patients and parents, we do. So we have become patient experts in our own condition, but then there's a bit of a power struggle when you go to your GP or your pediatrician or whoever you're seeing, and you present them with this research that you've found, or a bundle of research, and say, right, okay, I think this is what's happening. I think this is what we need to do. Here's how we solve the problem. And they're not really actually willing to listen or to act on that. So it's a case of, if patients can't convince their clinicians to accept that they are the expert on their own illness, the Scottish Government needs to make sure the education is there, and then they need to educate the clinicians.
Might it also be that clinicians are perhaps suspicious of the work that patients might be doing, particularly if it's informed online rather than in different sources? Do you think there's an element of suspicion?
Yeah, and quite rightly so. Not every research paper is made equal. There is good and bad research, and that's where Long COVID Kids comes in. You know, we have our expert advisors, and they can go through the research papers and say, okay, well, this is a good one because of these reasons, this is a bad one because of these reasons. So we try to collate the research which is going to be helpful, and make sure and kind of direct families to that research rather than something else that may not be quite as useful. But yes, there is definitely a suspicion. I would say an unwillingness to accept that that we know what we're talking about.
Okay. Just in relation to your diagram, first of all, can I compliment you on the diagram, because it's many times we in this profession look at diagrams and think, I have no idea what that is about. But in your case, it is very clear. There are two aspects that I'd like to ask you about. The first is mental health. I'm not ignoring any of the others, but I'd like to ask you particularly about mental health. Now, are you talking here about the mental health of children or the mental health of their parents?
Everyone involved. Before I talk about that, it's actually really interesting because I remember making this, and we still use it now. I remember making this in 2021, I think it was. And it's so devastating to realize that it is still entirely relevant today. So there is nothing different. Nothing has changed. Okay. So yes, it would be the mental health of the whole family. Right. It is an incredibly difficult situation for a family to be in, particularly when there's such stigma attached to long COVID. You'll find that even your own family members, your own immediate and extended family members, will not actually understand, or perhaps be a little suspicious that how could a child possibly be this unwell? It's very difficult to understand long COVID in children if you haven't seen it and experienced it. So there's a lot of isolation because there's very little understanding in the general community, and that also ties into the lack of public health communication from our public bodies. They have not informed the public about how bad long COVID can be, and so nobody is really, aware of that. Nobody's understanding it. So there's, it's incredibly isolating. It's also that it's a massive impact on the child's mental health when they are growing to their, the doctor is somebody who is there to help you and is there to make you better and healthy and well. And when a child is faced with a clinician who has not been supported with training, and they're shrugging their shoulders and saying, well, you know, your blood tests are fine, there's nothing wrong with you, go back to school, you'll feel better, or it's just anxiety, so, you know, you just basically have to deal with it, or send you to a website to look at. The dismissal in a young child is devastating for them. The medical trauma that the children have been through in the Long COVID Kids Support Group, you can't measure it. And there is a massive distrust now and resentment from the children themselves. And it's just so hard when my own daughter, you know, she'll tell, we've had to get private healthcare because we've given up trying to get any NHS support. And even with private healthcare who are experts in long COVID, they know what they're doing, she's saying, oh, well, they're not going to do anything, are they? You know, what's the point? That's her whole attitude and opinion is, what's the point? They're not going to help anyway, and they're just going to say that there's nothing wrong with me.
Can I
and
also,
you know, these children are going to, God willing, turn into adults. And what's going to happen when we have a proportion of these adults who have had long COVID when they were children, having this distrust and resentment towards these public bodies who are supposed to be helping and looking after them and caring for them? They have a duty of care, and that duty of care has not been upheld.
Could I also just ask you about the physical side of this, which you mentioned in your chart, diagram? I think you mentioned earlier that there is a perception that long COVID equals fatigue. And I think what you're saying in that little block there is that the symptoms are much wider than fatigue. Obviously, fatigue may be one of them, but the symptoms are wider. And perhaps you could just indicate what your experience and as a representative of long COVID kids is in relation to the physical symptoms that can be manifested.
Yeah, so within our support services, we see sort of groupings of symptoms, really, constellations of symptoms, we call it. So, you know, there will be a subset of children who are having very severe gastrointestinal symptoms and perhaps new allergies, things like that. And that will be a subset of those children. There are children like my own daughter whose symptoms are very much neurological and brain-based, basically. And so there's that subset of children, and their long COVID manifests in that way. And then there's other children who will manifest in more of a, you know, perhaps musculoskeletal, and they're struggling to walk, and they're having to use wheelchairs now, which, by the way, the NHS won't give them. And sometimes you get some children who have all of these things. So I think when people say, you know, long COVID is different for everyone, that is true. And that is, you know, within the nature of the virus. I mean, the virus can affect any part of your body, which then makes sense that long COVID can manifest in different ways, depending on what has been more damaged, essentially. So the symptom burden can be absolutely enormous. I mean, for example, my daughter is asleep right now. She didn't sleep all night. She's living in Australia, apparently. She didn't tell me. And she'll sleep now until the evening, and there's very little that I can do about it. Just got to let her sleep. Her body needs the rest. She needs a wheelchair to get around. She has a condition called POTS, which is postural orthostatic tachycardia syndrome, which is very common in children after COVID. So she's on a lot of medication. and she is bedbound right now. And there are children at varying degrees of severity and disability. It fluctuates and it wanes. Remit and remission. It's a very confusing condition, extremely debilitating. And, this just is not widely known. It's not widely known at all in the public space.
Thank you. Now, I think in paragraph 2.4, that most of what you say in paragraph 2.4 are matters that you've already touched upon, and I don't intend to repeat that. Obviously, everybody can read that section. You conclude at paragraph 2.5 that, I suppose, criticizing the absence of high quality and biomedical pediatric research has led to poor outcomes. Do you know if there is a level of improvement in that type of research going on now, or is it static?
Yes, there is, but not in this country. I'm not really up to date on what funding calls are going on in Scotland right now, but when they did do the funding call at the beginning of the pandemic, most of the research studies were based on either social research, really. Not a researcher. I don't know how to term it properly, but like psychosomatic, mental health. There was no biomedical research looking into the mechanisms underlying long COVID to understand what long COVID is and why it's happening. At the moment, I don't know if there's any research going on at all. There could be, so don't quote me on that. But there was no pediatric research at all. Okay. At all. So that I do know.
The next, the next few sections of your statement deal firstly with inadequate education provisions, then lack of mitigation measures in schools and hospitals, and then lack of flexible employment, carers, and cumbersome welfare system. Now, I think, as I've indicated to you, Ms. Goss, these are areas that my colleagues within the inquiry team will be specifically looking at, and would obviously, I have referred what you have said in this section of your statement to them, and they will be looking at it in more detail in the context of specifically education and welfare. So just for today's purposes, I'm going to ask you to take those passages as read. We have all got it in front of us, and I'd like to take you on to the final part of your statement, which is about human rights failures. And if you could perhaps...
Could I possibly speak to the hospital side of that?
Well, if you wish, yes.
That would fit into healthcare.
Right, okay.
Very, very briefly, the fact that mitigations and protections have been taken away in our NHS means that attending medical appointments for children with long COVID is one of the most dangerous places that they can go. We know that reinfection will more likely than not make your long COVID worse. It certainly has been with my daughter and plenty of others, most others. If there are no mitigations in the hospital and they catch COVID-19 in the hospital as a hospital-acquired infection, which I don't know if that's still being even recorded anymore with COVID-19, then it is harmful to them to even attend any appointments. So I think it's important to have that noted, that we have been campaigning for mitigations in healthcare.
Right, well, we will have that noted, certainly, Ms. Goss. Can we go on to human rights failures, please? It's section 6 of your statement. And I'd like you to read those 3 paragraphs, please, so that we have it before us.
Prolonged illnesses, such as long COVID, have implications on children's right to life, survival and development, education and health, and their well-being. Children and young people have a right to have their best interests considered and implemented at policy level. We urge the Scottish Government to recognise the significance of long COVID in children and call upon it to address its human rights implications in line with GERPEC. The Children and Young People Scotland Act 2014 and the United Nations Convention of the Rights of the Child. On 6th of August 2020, the UN Committee on the Rights of the Child published a statement expressing concern about children globally due to the effects of COVID-19. The Scottish Government set out its approach in relation to 11 areas highlighted by the committee, yet there are no mention of children and young people suffering from long COVID. The linchpin of our organisation is that multi-layered protections against contracting COVID-19 are the only way to drive case rates down and reduce the spread of the virus, which would in turn reduce the incidence of long COVID. It is vital that the Scottish Government leads this and upholds their duties.
Right. Ms. Goss, that's really all I want to ask you today. Thank you very much for taking the time. I know it's been difficult, and we are very grateful as an inquiry that you've taken the time to put your statement together and to give the time to engage with us today. So thank you very much indeed.
No, thank you very much, and thank you for having me.
Yeah, thank you very much indeed, Ms. Goss. I'm very grateful. Good.
Well, that's it. Business for today.
Very good. Thank you very much indeed, Mr. Gale.
Tuesday.
We're not sitting tomorrow.
We're not.
Because the owners of this building require for something else to be blunt about it. It is theirs, although we are paying rent. So we're not sitting till Tuesday. Tuesday at 10 o'clock.
Thank you
very much.